Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back to Aging in Place Strategies and Answers. As you know, I am passionate about helping clients and their support systems learn more about aging in place and how to navigate a health crisis. Your medical insurance is a key player in your health strategy as you plan to age in place. However, few people really know what kind of health care coverage they have and what it means. In the previous episode, I asked you to take your healthcare card out of your wallet because there is a lot of information on the front and the back of that card. When you enroll in Medicare, you will be able to choose the right care option that fits your budget and your health status. And you will be able to choose between traditional Medicare plans or Medicare Advantage plans. Here are some basic things to know if you are 65 years of age. You are eligible to enroll in Medicare health insurance if you would like to take it. Medicare.gov has a lot of answers for you, and that's where you will go to look for the information you need. At Medicare.gov, it is written very simply, and if you take the time to read it, you will understand it. Once you enroll in Medicare health insurance, you will be issued a red and blue Medicare card, and it will have your personal Medicare number, and it will have the kind of insurance you enrolled in and the date of enrollment. If you are still working and choose not to enroll in Medicare, you need to read the section pertaining to that option. When it comes to health insurance decision making, there are specific guidelines and there are different kinds of insurance, which is similar to what you might have when you are employed. Original Medicare includes Medicare Part A, which is hospital insurance. And I like to think of that as acute care, A meaning acute. And Part B is your medical insurance, more subacute. It is your doctors and your labs and your diagnostic tests. You can join a separate Medicare drug plan to get Medicare drug coverage. Drug coverage is available under Part D. D for drugs. You see, I like to keep it simple, and I like to explain it in simple ways so that people can remember and understand. When you choose Original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the United States. Be aware that different states offer different insurance plans. Different counties within the state can offer different insurance plans. If you move out of the state or to another county within the state, you're going to have to check in with Medicare.gov to make sure that you are still eligible to use that medical insurance at your new address. A separate insurance card will be sent to you from the insurance carrier if you have chosen a Medigap or a Medicare supplement plan, or have enrolled in a Medicare Advantage plan, and it will show you what type of plan you have enrolled in. One of the most difficult things to understand is that Medicare Advantage plans are not traditional or original Medicare, but they are Medicare approved plans that are issued from a private insurance company. And there are many different plans to choose from. Many of them are bundled to include Part A, Part B, and usually Part D. In some plans, you can only use doctors who are in that plan's network. In many cases, you may need to get approval from your plan before it covers certain drugs or services or tests or procedures. Typically, these plans may have lower out-of-pocket costs than Medicare, and some plans offer extra benefits that original Medicare doesn't cover, like vision, hearing, and dental. Here's a quick illustration that I want to share with you about the importance of knowing what kind of insurance you have and making sure that your insurance will be taken when you call the doctor or go to the hospital or emergency room. When I was working and carried health insurance through my employer, the carrier was the same carrier as the open marketplace insurance offered through the government, or what people refer to as Obamacare. When I called to make an appointment with a physician and they asked what kind of insurance I had, they said, I'm not sure we take that insurance. And after a couple of phone calls, I was finally able to get the picture. Because the state health insurance plan was a notoriously slow pay or didn't approve of some procedures or tests, my physician's office was reluctant to accept my insurance. The workaround for this was I told them that I worked for a private company, and then all of a sudden I was able to make an appointment because, yes, even though it was the same carrier, they understood that my plan was different. And that is just one simple illustration of the way the insurance you carry can affect your ability to make a doctor's appointment. One time a year, there is a time frame where you can enter into open enrollment. And this will be the time that you can make changes to your health insurance plan. And it usually occurs from November to mid-January in most states. I always liked to check my mother's health insurance when she was alive and see if there were lower cost drug plans. And there usually were. My mother and I would discuss this, and every year she said the same thing. Linda, do not change my health care coverage. My providers like my insurance, and I have not ever had any trouble getting in to make an appointment, to be seen, or to have procedures or operations. It was the first time that I had to look and see what plan she was in and who was her carrier. But she was absolutely right. She was in a good plan, but from year to year, we might change her drug coverage to save money on her premium. And she had traditional Medicare with a supplement. There have been times that I have talked with clients and their adult children, and they are at a loss as to why the hospital is only letting them choose from a short list of rehab stay providers. I listen to their concerns and tell them that the choices they are given are based on the insurance they have, to which they say, I'm beginning to see that, and we are definitely going to be making some changes to my parents' insurance plan now that we can see that their health needs have changed and we have learned a little more. Remember this: if you move or lose your health insurance or have another qualifying event, there can be special enrollment periods. This next section is going to sound a little bit like school, but like I've said before, this is our opportunity to learn more about original or traditional Medicare and to get educated so that we can make the right decisions. Medicare Part A. The easiest way for me to remember what it pays for is I use the A to mean acute care. Part A actually covers inpatient hospital care, skilled nursing facility care, hospice care, lab tests, surgery, and home health care. Medicare Part B is subacute or outpatient and is very different from being in an acute situation. Medicare Part B covers doctor's visits, labs, testing, and therapy. It includes medically necessary services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of practice. Preventive services are also covered under Part B of Medicare. That means health care to prevent illnesses like the flu or to detect it at an early stage when treatment is most likely to work best. For me, remembering what Medicare Part D is, I think of D and drugs. The prescription drug benefit is the part of Medicare that covers most outpatient prescription drugs. Part D is offered through private companies either as a standalone plan for those enrolled in Original Medicare or as a set of benefits included with your Medicare Advantage plans. Here are some other terms that you should know. A deductible is the out-of-pocket expense you pay before the plan coverage begins. A copay is the dollar amount collected at the time of your professional visit. Medicare assignment. Medicare assignment is an agreement by your doctor, provider, or supplier to be paid directly by Medicare, and they accept the amount that Medicare approves for the service. The provider also agrees not to bill you for any more than the Medicare deductible or the coinsurance. If you're like me, you probably have 100 more questions, but that's what Medicare.gov is for. And of course, there are also advisors that you can call to learn more. But I'm going to keep this pretty high level. And then just stay tuned because I'm going to be interviewing a Medicare advisor that is an independent, not a broker, so that you can learn a little bit more information. I remember seeing stacks of paperwork at my parents' house after a hospitalization or a rehab stay, and all that paperwork gets very confusing. But I don't want you to be confused. I want you to know exactly what those statements are and what they mean. Medicare Advantage plan members will receive an explanation of benefits. Some people abbreviate that to be EOB. but a traditional Medicare member will receive a Medicare summary notice. It's important for you to save any information that you receive from your medical providers, and when you receive these explanations, match them with the appropriate bills. They really are easy to understand if you just take your time, take a deep breath, be free from distractions, and look over the statement. Look at the treatment date. Look at the provider. Look to see what was paid and who was paid. Usually, Medicare pays first. You'll receive a statement for that. You will also receive another statement when your supplement has paid, if you have one, and what they paid. And that statement will look different with Medicare Advantage plans, like I said. You will usually know how much of a deductible you have left. You will know what was allowed by Medicare or the Medicare Advantage plan, and then what was paid to the provider. You will also be able to see what was not covered and then the reason why. You will see a balance left that you could be billed by your provider, but be aware that you are not responsible for a leftover balance because of Medicare assignment. But they may go ahead and list that amount that you might be billed, because at that time that supplement has not paid or be involved, or people might choose not to get a supplement to their original Medicare. A couple of years ago, a family member went to an urgent care provider and had a CT scan, which is usual and customary to establish diagnosis. However, when the bill came, it was noticed that the CT scan was denied, and it showed that the whole amount of that test was owed, and it was pretty significant. Working with clients and helping my parents, I would issue this statement or in an attempt to make sense out of nonsense. If your physician has ordered it, it probably was just coded wrong. But if you have a question or you see something like that, go ahead and call the billing office and let them know that that was a decision of your provider and it's on them. The more you understand your health insurance, the more you will feel like you have control and can plan better. In the years that I have educated myself on Medicare plans and have helped adult children understand their parents' plans, I have come to the conclusion that when it comes to insurance, it's just numbers. So whether you have traditional Medicare insurance or you have opted into a Medicare Advantage plan, just know what those numbers are and then compare them. Don't take somebody else's word for them. Look at them yourselves. Here's a couple of questions I think you should ask when choosing medical insurance for yourself. Is this plan correct for my current health status? What are the advantages of having the plan? Are there any disadvantages of having the plan? Am I getting the freedom to choose any doctor, or are my choices limited? What will be my total out of pocket if I have a health incident this year? Remember, that's what insurance is. It's planning for the unexpected. And as I've learned, and you probably have too, the unexpected can happen. And then another question I might ask, and this is probably the one where you can save the most money, is does my drug coverage cover my current prescriptions? And what is the reality? What does it really look for my out-of-pocket costs with that particular plan that I'm thinking about choosing? Having insurance, as you know, can be a challenge. Visiting with billing people can be a challenge. And I'm just going to share real quickly a challenge from my own life. Even when I invested my time and planned carefully, things can go wrong with coverages and billing. I had a car accident in 2022, and every provider took down my medical insurance meticulously in their intake notes. Once I was in the emergency room, the person in charge of admissions took down all my insurance info and made a copy of my card. So I was feeling fairly confident that everybody really knew what kind of insurance I had and that everything would go reasonably well. Well, when the bill started arrived, it showed that I owed the whole bill. In fact, it showed that I didn't even have insurance after I examined it a little further. Well, it could have been that it was a car accident, and they might have thought that there could have been another payer source, like the insurance company or something, but quite frankly, they never asked that question. It was just me thinking that. So I waited a bit to see if the information would catch up. All that meticulous information that was taken at the beginning, right after my accident, whether that would catch up with the billing department. But I'm sorry to say that was not the case. In addition, when the bills started rolling in, it took several phone calls to the entity in charge of the billing to clear up the issues. Because at one point they said, oh yes, we see your insurance, and they billed an insurance that I didn't have anymore. For the ambulance and the hospital, they ran it under an old provider, and the bills came back unpaid again. Well, after looking at the information, I could see what happened, and then I had to make another phone call to straighten it out. And I know I'm preaching to the choir. I know these things have happened to you, but this is the importance of knowing what kind of insurance you have, looking at the statements, being knowledgeable, and pursuing correction if you have gotten caught in one of these traps. It is a huge task when you're feeling well, but when you're not feeling well, it is overwhelming. As I have mentioned, I remember seeing stacks of insurance papers at my own parents' homes, but in the years that I've worked with clients, I have seen dining room tables that have stacks and stacks of insurance papers on the table waiting for someone who knows what to do with them and knows how to problem solve. If you are a caregiver, or you're good with insurance forms, or you feel like you want to help somebody, that would be a good place to begin to say, let me look these over for you. Let me match them up with the provider and the tests that you have had, and let's try to get a handle on what you think you owe or what you don't owe. Along with the stacks of papers, I have also seen tons and tons of pharmacy paperwork and pill bottles and all kinds of stuff that people don't know what to do with, but I'm going to wait for another day to discuss and pill bottles and pharmacy paperwork. I have learned that insureds can receive wrong information from the people trying to help them. But at this time, these things are not covered under Medicare. Well, they're not particularly happy because they don't see me as a better expert than Medicare, which I totally agree. I would validate that 100%. However, there is a Medicare beneficiary hotline that you can call, and that will validate the fact that non-medical home care is not covered under your Medicare plan or your Advantage plan at this time in the United States of America. So even calling Medicare can give you wrong information. So stay tuned. We're going to be talking about this more. And remember, I have an expert coming on in my next podcast, so you will learn more then. Remember that I mentioned that insurance plans can vary from state to state and from county to county. Well, there is an insurance provider who only operates in the area that I live, and they do things very, very differently. And many insureds are very happy with the care they receive from this private insurance only located in our area, but sometimes they're not so happy. And If they have health concerns and have had procedures or have to go to skilled rehab, that is when they can find that some of their choices are very limiting. Like you, many people receive tons of robocalls near open enrollment. There is a lot of information that is sent into your home. There are a lot of scams out there to get you into a plan that you didn't know that you got into. Well, that's against the law. So if you find that you did not get into the right plan or were put into a plan erroneously and that you didn't understand what the plan was, you need to reach out to Medicare immediately. Be aware that insurance brokers are great. They can guide you and explain what kind of insurance options are sold in your area, but you might want to be aware that a broker is paid by insurance plans. They're paid on initial enrollment, and they are paid again when you make plan changes to your plan. Just a quick reminder that I will be interviewing an independent advisor on my next podcast, and she will be telling us more about open enrollment, special enrollment, and then helping us to understand a little bit more between traditional or original Medicare and Medicare Advantage plans. Here is my caregiver tip for today. Caregiver responsibilities can be varied. You could be providing hands-on care. You could be providing shopping or transportation to appointments. You could be paying bills or haggling like I did with billing departments. You could be making meals or providing light housekeeping or even keeping vigil at the hospital. It is a fact that most caregivers do not have time to address their own health issues. It's important in order for you to take care of somebody else, you really need to take care of yourself. Join me again on Aging in Place, Strategies and Answers. Thank you for joining me today. Please subscribe and share episodes with friends and family who are currently in crisis or are ready to start developing their own roadmap for aging in place. Remember that this podcast is guidance and not advice. If you have more specific questions related to your particular situation, please reach out to me at linda.agingstrategies@gmail.com. Join me again next week and we'll learn more.